This video is about the Panorex series, also known as the orthopantomogram or OPG. We'll walk through the correct CPT code, standard radiographic view terminology, and finish with a real-world radiology report example to support coding accuracy. The primary CPT code used for a panoramic dental X-ray or orthopantomogram is 70355. The CPT is defined as orthopantogram, e.g. panoramic X-ray. This code applies when a single, wide-scope image of the mandible, maxilla, and teeth is captured, commonly referred to as a pano view. Note that this is a single image study and should not be confused with multi-view mandibular series. The panoramic view provides a comprehensive, two-dimensional image of the entire lower face. It includes the maxilla and mandible, the teeth, both upper and lower arches, the temporomandibular joints, and surrounding bony structures. This view is often used in dental evaluations, trauma cases, and TMJ assessments. It allows for efficient detection of abnormalities such as impacted teeth, cysts, tumors, and dental caries. Let's look at a sample radiology report to understand how findings are typically documented for this study. Order exam. Mandible Panorex. Header, mandibular Panorex radiograph. History, injury, comparison, none available. Findings, large dental caries seen in the right mandibular first molar. No abnormal periapical lucency is identified and no fracture. Aerated spaces are clear. Impression, right mandibular first molar dental caries. This structured format highlights the anatomical focus, any pathology, and relevant negative findings, all of which support accurate CPT code assignment. Let's review the ICD-10-CM coding for this emergency department Panorex report. The exam was ordered for injury, but the radiology report documents large dental caries in the right mandibular first molar, no fracture, no abnormal lucency, aerated spaces are clear. Although tooth decay was noted, there was no evidence of traumatic injury, which was the reason for the exam. If the clinical history only says injury or trauma with no detail, the coder should check the ED provider's note for more specifics. Look for mechanisms of injury, such as fall, assault, sports injury. Assign a more specific code if possible, like those in the S00 through S09 range for head and face trauma. Negative trauma imaging should not be coded to injury codes unless there is supporting documentation. When in doubt, consult the ordering provider or facility policy for guidance. However, if the chart lacks that detail and the report is negative for injury, the most appropriate diagnosis code is Z0.3. Encounter for examination and observation following other accident. This code is used when the patient is examined after an accident or trauma, but no diagnosis of injury is made based on the imaging. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.